Welcome everyone. Today's session focuses on the Autumn 2024 Chief Examiner Report for the T-Level in Health, specifically the core papers A and B. We'll examine student performance, identify strengths and gaps, and explore how we can adjust teaching and delivery to improve learner outcomes. The core papers were sat in December 24, with paper A focusing on workplace practice and care principles, and paper B covering human anatomy, physiology, and science-based content. This session is structured into what went well, areas for development, key patterns, and teaching implications, supported by question-level visual data. Let's begin with the key themes for Core A. Students performed well in several key areas. Many demonstrated a secure grasp of evidence-based practice in areas such as question 6, linking patient care improvements to research and clinical protocols. Also, question 8 on increased service demands was particularly strong. Students analysed effects on waiting times, staff workload and care quality. Question 9, where students assessed the impact of technology on both a practitioner and her parents, many reached Band 3 by giving well-justified, balanced conclusions. Person-centred care responses were encouraging, particularly in question 31 on holistic recovery and question 33 on evaluating an occupational therapist's approach. Students who drew on practical examples and used structured reasoning excelled. Despite the strengths, there were consistent challenges, such as misreading questions led to avoidable errors. In question 5B, students focused on the consequences for a healthcare assistant rather than the impact on the wider organisation, showing gaps in AO2 application. Terminology was a barrier in question 11, such as MAR, and question 28A, the MACC. Many students either left these blank or gave unrelated answers. Low scores on safeguarding related items, such as question 12, revealed misunderstandings of who was at risk, the child, not the patient. In maths-based questions, students lost marks from missing units or not showing working, as in the case of question 13 and question 18. A noticeable number of blank or crossed out responses suggested time management issues or reduced confidence. This visual shows question level performance across paper A. Red bars indicate questions with widespread underperformance and green show strengths. So notice the weaker areas. Question 5B, 11, 12, 13, 18, 23, 28A and 29. These involve terminology, safeguarding, legislation, or deeper AO2 or AO3 understanding. Stronger performance appeared in question 6, evidence-based practice, question 8, department pressure, question 9, technology impact, question 28 and 33, which was manual handling and occupational therapy evaluation, and question 31, holistic care. The following themes emerged from paper A. Clarity and focus are essential. Students who understood the question, responded precisely, were most successful. Evaluation and planning led to higher bands. Those who planned the responses, especially in longer, open-ended questions, achieved better structure and deeper reasoning. Real-world application matters. Students who referred to healthcare protocols, placements, or real service context stood out. Professional role understandings needs work. Students must understand the responsibilities and limitations of roles like healthcare assistants, nurses, and practice managers. To support learning further, prioritise science-specific terminology. Use labelled diagrams, visuals, and quizzes for consolidation. Deliver maths weekly in a health context, including BMI calculations, temperature conversions, drug dosages, and data interpretation. Use clinical case studies to teach application. Ask students to interpret data or explain physiological impacts in structured responses. Strengthen AO3 writing. Use modelling, sentence starters, and peer review to improve how students justify or evaluate conclusions. Now let's explore the key themes for Core B. Paper B, which assesses anatomy and physiology systems, saw solid performance in question 6, where students explained genetic causes of muscular dystrophy. Question 8, evaluating the physical and mental effects of COPD. Many students included mental health considerations, showing depth of understanding. Question 9, where consultants' advice was critically assessed in the context of chronic illness. And questions 16 to 17 and 24 to 25 showcase structured, thoughtful responses to immune system conditions and care strategies. However, there were several issues to address. Question 11 and 21 highlighted maths weaknesses, rounding errors, and missing units were common. In question 14, students confused MRI scans with X-rays, sometimes stating MRI involves radiation. Question 15 responses often copied questions' content or defined Crohn's broadly without discussing absorption in the small intestine. Question 22, a definition of antigen, was widely left blank or answered inaccurately. Question 23, which required evaluation, was often answered descriptively, showing weak AO3 performance. This visual shows Paper B's performance patterns. Weaker responses came from question 11, mass roundings, 14, MRI, 15, absorption, calculating range in 21, antigen definition and evaluation. Strong responses were seen in question 8 around COPD, question 9, consultant advice, immune conditions in 16 to 17, and clinical reasoning in 24 to 25. Again, strong application and evaluation were linked to Band 3 performance. Key themes from Paper B. Students need to connect clinical knowledge to the question context, especially where case studies are used. Maths and science require ongoing integration, particularly with units and formula rearrangement. Many students struggle with evaluative writing, listing facts rather than critically engaging with a statement or scenario. To support learners further, prioritize scientific specific terminology. Use label, diagrams, visuals, and quizzes for consolidation. Again, deliver maths weekly in a health context, including BMI calculations, temperature, drug dosages. Use clinical case studies to teach applications. Ask students to interpret data or explain physiological impacts in structured responses. Strengthen AO3 writing. Use modelling, sentence starters, and peer review to improve how students justify or evaluate conclusions. And really support misconception checks, so using knowledge organisers and retrieval tasks to correct these misunderstandings. So some final thoughts around assessment objective patterns and next steps. Before we wrap up, it's important to look at performance through the lens of assessment objectives. AO1 for recall, AO2 for application, and AO3 for analysis and evaluation. These help us understand the deeper skill patterns behind student answers. So beginning with AO1, recall of knowledge. AO1 is generally strong when questions involved familiar content, for example, dates or simple SOP definitions. However, where terminology was less familiar, such as MAR or antigen, students frequently left answers blank or guessed. Students sometimes used vague, imprecise language, especially in safeguarding or well-being responses. So what's this implications for teaching? Building consistent retrieval practice, term matching tasks, and student-friendly glossaries. Use quick oral quizzes and explain it back tasks to reinforce vocabulary. Incorporate term definition, image matching into regular starter activities. AO2, application of knowledge. Application was a strength in questions like evidence-based practice and impact of technology. Students who understood what the question was asking and applied knowledge to the scenario often did well, particularly in Paper B's clinical questions, such as question 8 and 16 to 17. But when students misread or misfocused, such as question 5B, where they focused on the healthcare assistant, not the organisation, or questions 12, wrong safeguarding subject, marks were lost. So, implications for teaching. Teach students to deconstruct questions, highlight the focus, subject, and required format of the response. Build in what is this question really asking activities. Role-based scenarios can help students practice and applying knowledge to a realistic healthcare context. For AO3, analysis and evaluation, high performance students reach band 3s in question 8, 9 and 22 in paper A and question 16 to 17 in paper B through structured reasoning, balanced judgment and strong linkage to scenarios. However, many students defaulted to descriptions over evaluations, particularly in questions such as question 3 and question 9 for paper B. Without justifying their views or linking back to case studies, students remained in band 1 or 2. So your implications for teaching. Use exemplar answers and comparison tasks such as band 2 versus band 3 to model progression. Encourage use of evaluation prompts. How effective is this? What does this mean for patient care? And why might this be a challenge? Frame evaluation tasks using answer structures and scaffolds. So to conclude, overall performance is improving, particularly in real-world application and longer responses. Next steps should include focused support for AO2 and AO3, particularly around precise application and evaluative writing. Clear teaching of terminology and structured question planning will continue to make a difference. Students' understanding is progressing, especially when theory is tied to real-world healthcare settings. Please take a few moments to complete this feedback form. We really value your insights. Thank you very much for watching.